Assalamualaikum and hi to Puan Suhaini binti Sulaiman. Today, our group will present our PBT. Before that, I will introduce myself. Hi, my name is Zainira binti Zainuddin and my matric number is 01DDT19F2072.
My name is Nur Intan Aisyah binti Hazali. My matric number is 01DDT19F2053.
Hi, my name is Nur Shafina binti Adamali and my matric number 01DDT19F2076.
Hi, my name is Atira Izzati binti Rosli and my matric number is 01DT19F2074.
Thank you everyone.
I will start with table of content. What there is: introduction, risk management plan, solution to manage the COVID-19 in the organization, mitigate action, risk assessment form, conclusion, and the last one is reference. For introduction is, many companies around the globe have been affected by COVID-19 pandemic and our company is no exception. Many companies have made the stand to digital. Working from home is becoming more common among employees to reduce face-to-face period. As a result, data and paperwork are shared and sent over the internet, making them easily accessible to outsiders and making cyber attack easier to perpetrate. It is important to take the appropriate action to start organizing the business as effectively as possible and to recognize how to minimize the risk. As our company top management, my team and I have proposed a list of organization suggestions to deal with the current COVID-19 situation. The next is risk management plan. There is a 5-step in risk management plan. The step 1 is identify the risk. The first step is to identify the risk that the business is exposed to in its organization environment. There are many different types of legal risk, market risk, environmental risk, and more. It is very important to identify as many risk factors as possible. These COVID-19 risks are involved in health risks as well as environmental risks, as they are related to the human respiratory system and the environment around workers. In a manual environment, these risks will be recorded manually. Risk management solution information will be entered into the system as evidence and reference material. Step 2 is analyze the risk. Once the risks that occur in organization are identified, they need to be analyzed for ways to resolve them. The scope of the risk must be determined. Understanding the relationship between risk and different factors in an organization is a very important factor. In a manual risk management environment, this analysis must be performed manually. When the risk management solution is implemented, one of the most important fundamental steps is to map risk to different business documents, policy, procedure, and process. The next step is step 3, evaluate or rank the risk. Most risk management solutions have different risk categories depending on the level of risk. Risks that can cause some inconvenience are rated low. Risks that can result in catastrophic loss are rated highest. This COVID-19 risk is based on if the employee complies with the SOP provided by organization. It is particularly important to determine the risk position as it allows the organization to gain a holistic view of the overall risk exposure of the organization. The business may be exposed to some low-level risk, but it may not require top management intervention. On the other hand, only one of the higher rate risks is sufficient to require immediate intervention. Step 4 is treat the risk. Every risk needs to be eliminated or capped as best as possible. This is done by liaising with experts in the field to which the risk belongs. The problem is that discussions are broken down into many different inventory across different documents and spreadsheets and many different phone calls. Discussion about risk and possible solution can take place from within the system instead of everyone contacting each other to get update. Everyone can get update directly from within the risk management solution. So that is all from me. Next, my friend Nur Shafina will continue this presentation for the step 5.
Thank you, Zainira, for letting me continue with the next part and also for your great explanation. By the way, my name is Nur Shafina binti Adam Ali and my machine number is 01DDT19F2076. Now, I will continue with step 5, which is for monitor and review the risk. So for this step, it is not all risks can be eliminated, such as the COVID-19, because it is a variant of the coronavirus, which is a type of disease that cannot be stopped until today because it is become a pandemic for all around the world. And after that, it will always be either a lot or a little. By monitoring this risk, the business can return to continuity. After that, I will continue about solution to manage the COVID-19 in the organization. Given the prevalence of COVID-19 cases, workers have concern about their potential for exposure to the flu in the workplace and steps to take to ensure their well-being. There are steps that employees and industry can use as follows. This is for gaining an understanding of COVID-19 to plan and act accordingly, where the incubation period is currently estimated to range from 1 until 14 days for workers experiencing the COVID-19 symptoms. After that, the workers who are likely to be exposed are workers who are elderly or who have high blood pressure, heart disease, lung disease, and so on. And then the next step is all parties in any organization should take appropriate measures to ensure maximum protection of staff and business, where it is divided into 3 categories, which is action by employee, action by employees, action at the workplace. First is for the action by employer. District supervisor to monitor employee symptoms in the workplace, encourage employees to take the temperature regularly and monitor it is a respiratory symptom, and communicate to the employee about the COVID-19. The employee need to advise on prevention method where it is include personal, respiratory, hygienic, and active. Remind employee of the needs to practice hand hygiene regularly, for example, via email, social media, and so on. And also need to provide regularly updates about the COVID-19 to employees and have to show the way how to use the surgical mask and provide appropriate health education material regarding COVID-19 to all the employees. And the second category is action by employees. The action by employees need to update on the COVID-19. The employees are encouraged to take their meal at their desk, have to limit the food handling and sharing of the food in the workplace. Always need to maintain a good personal hygiene, which is frequent hand washing with soap and water or hand sanitizer. If the COVID-19 develop symptoms, they need to inform to their supervisor immediately, and they need to wear the surgical mask and always need to seek medical treatment immediately if they are need, and have to avoid the contact from the fellow employee. Last category is action at the workplace. They have to ensure a clean and hygienic work environment through regularly disinfection of the office and its equipment. Always consider a no handshaking policy with others colleagues in the company. I need to enforce hand sanitization at the entrance or for visitor. Provide easy access to frequent hand washing for employees. Always need the proper maintenance of toilet facility and floor drains, provision of leader rubbish bin, regular refuse disposal, and educated supply of liquid soap and disposal towel. Need to consider different large meeting or event, and have to consider having a meeting outside in open air if possible. That's all from me. Next, my friend Atira Izzati will continue. Thank you.
Okay, thank you, Shafina. Now I will continue this presentation, which is for the last action at the workplace that required to ensure all precaution that can be taken in case of indoor meeting or event at the workplace. Okay, the first one is informing participants not to attend if they are unwell and to join the meeting using the virtual platform. Second is ensuring all relevant information is given to the participants, such as the practice of hand hygiene and the use of surgical masks for those who develop respiratory symptoms. And lastly is the surgical masks and tissues also required for those who develop respiratory symptoms. Okay, let's move on to the next content, which is the mitigate action. Okay, an organization is responsible to prepare the help tools like hand sanitizer, COVID-19 test kit, temperature, and also the scan mice detector to control the coping-acting virus and to prevent the disease from spreading by air, and the items that management provide. For example, the meeting room, chair, and desk needs to be sanitized after being used. Next, make a limitation of company staff, such as working schedule that need to be generated by a manager, so the work area is not overcrowded and can reduce the potential for continuous coughing infection to occur. In addition, the required self-cleaning care for all organization staff, like washing hands often with soap and taking a shower after getting home. Next is performing the social distancing care at 1 meter with others to prevent the transmission of COVID-19 as the SOP procedure. An organization is instructed to not touch each other, like shake hands from affecting others and reduce movement. Furthermore, require all employees of the organization to wear masks before and after entering the building to help prevent the respiratory fluids from being spread into the air through coughing and sneezing when worn, in order to reduce the spread of respiratory fluids such as coughing and sneezing by covering the mouth and nose. The KF94 is the best mask to use because it contains 4 layers of protection. Moreover, by performing self-quarantine on workers of an organization, staff who have affected or show symptoms of the COVID-19 virus, this method include restricting movement for 14 days or less, to maintaining antibody hygiene and avoiding the spread of COVID-19. Lastly is required all organization staff to receive the full COVID-19 vaccination as well as a vaccine booster in order to prevent and strengthen their antibodies. Okay, that's all from me. Now I will pass to Intan Aisyah to continue for the next
Thank you,
one.
Adira. Now I'm International. We continue about the risk assessment form. Okay, first issue is about do not maintain a social distance from others. People who are at risk of being injured or are employer and staff, customer, visitor, cleaner, and the supply. Okay, this is the way to control the risk. Limit the number of customer present when meeting with employers on duty. If possible, it is better to schedule a virtual meeting or appointment using web conferencing software such as Zoom or Skype. Limit the time or number of employees in the company to work, it is better to introduce a system of employers who work in rotation or continue to work from home using an existing platform. The next action that needs to be taken is based on side 8 about the importance of why it is necessary to keep a distance 1 meter with others. Make a cross mark in every location and footprint mark on the floor so that they will maintain social distancing from others. Always provide and remind the instruction about the social distancing. Okay, the person who needs to carry out the action is employer, staff, company, and visitor. This action should be carried out at all the time when in a crowded place in the workplace. The process to resolve this issue is ongoing. The second is do not wear a face mask. People who are at risk of being injured are employer, staff, company, visitor, cleaner, and the supplier. It is the way to control the risk. Needs to always wear a face mask to avoid COVID when in a crowded place. As MKN said, the rules do not allow people not wearing face masks into the premise. This is the action that needs to be taken. Is provide a free face mask for the employer and the customer. Do not wear or use face mask and every 8 hours must change to a new face mask. The company should be firm in tightening the rule to always wear a face mask based on side 8 about the information of the importance to wear a face mask. The person who need to carry out the action is employer, staff, customer, visitor, cleaner, and the supplier. This action should be carried out all the time when it is in a crowded place in the workplace. Okay, the process to resolve this issue is ongoing. The last risk assessment is does not washing hand regularly and does not use hand sanitizer. People who are at risk of being injured are employer, staff, customer, visitor, cleaner, and the supplier. It's the way to control the risk is everyone should always wash their hand and regularly sanitize. Washing the hand with soap and water for 20 seconds. Recommend using alcohol-based hand sanitizer containing at least 16% alcohol. Rub the hand sanitizer all over the hand. Make sure to get between the finger and on the back of the hands. The next action that needs to be taken is provide hand sanitizer and hand soap everywhere in the company. Need to add other facilities to allow it to be easy and frequent to wash hands and sanitize. Based on scientists, as a reminder for people to wash and clean their hands. Here's how to wash and sanitize hands properly. The person who need to carry out the action is employer, staff, customer, visitor, cleaners, and the supplier. This action should be carried out at every 2 hours before or after doing any work. This process to resolve the issue is have been done. Okay, next is conclusion. It is critical to identify effective strategy to manage risk to minimize the hazard while maximizing their possibilities. During the COVID-19 pandemic, the social and normative standards were established. They will always be the change of new threat emerging. The presence is will be easy to reference for the organization and will be reason to assess in identifying risks that require more attention because they may frequently appear out of nowhere, posing bigger danger and harm. To summarize, regardless of department or job status, each employer must be aware of comply with the risk management plans and risk assessment that have been provided to avoid issue for arising. Okay, this is reference which is we use as an example. It is all for my group. Thank you.